Hello everyone. Welcome to the Medic World Study with Dr. Mahi. Today we will discuss the previous year questions of NEET PG 2021 of the subject Anatomy. So let's start with our first question, that is, a patient presented with vision loss. On radiological investigation, an aneurysm causing damage to the optic chiasma. Aneurysm causing damage to the optic chiasma was noted. Which of the following arteries is most likely to be the artery that is causing the damage? Let's see the options. Anterior communicating artery, anterior choroidal artery, middle cerebral artery, and anterior cerebral artery. So, the answer to this question is option A, that is anterior communicating artery, because the aneurysm of the anterior communicating artery, it is the most likely to be causing damage to the optic chiasma, which leads to the vision loss in this patient. Now the next question is, a 34-year-old man presented with fever and massive splenomegaly. Fever and massive splenomegaly. On palpation, the spleen was 15 centimeters and directed obliquely when measured from the right iliac fossa. Which of the following structures prevent the vertical and downward descent of the spleen? Let's see the options. Linorenal ligament, gastrosplenic ligament, phrenicocholic ligament, and linophrenic ligament. Among the following, the phrenicocholic ligament is the ligament which prevents the vertical and downward descent of spleen. It is not attached to the spleen. It attaches the diaphragm. Phrenicocholic ligament attaches diaphragm, phrenico means diaphragm, to the splenic flexure of column, and it prevents the vertical and downward descent of the spleen. So the answer is option C. Now the next question. Identify the papilla from the given histological section. Let's see the section. As we see in the section, the papilla which is given is the circumvallate papilla of the tongue, and it is the largest papilla of the trunk. So the answer is B. Now the next question. A 7-year-old boy was brought to the hospital with multiple fractures of humerus secondary to a fall from a height. On examination, there is difficulty in flexion of elbow, supination of the forearm, and associated with loss of sensation over the lateral aspect of forearm. Which is the nerve most likely to be injured? According to the given clinical scenario in the patient with difficulty in flexion of elbow, supination of forearm, with associated loss of sensation over the lateral aspect of forearm, is suggestive of the injury to the musculocutaneous nerve. So, answer to this question is option C, that is musculocutaneous nerve. Now the next question. A patient presented with a jaw swelling and weight loss. Suspecting a malignancy, the submandibular gland was resected. Which is the most likely nerve damaged during submandibular gland resection? As we know, there is a nerve known as lingual nerve passes through the submandibular duct. It loops around the submandibular duct. Hence, it is susceptible to injury during submandibular gland resection. So, the answer to this question is option C, that is lingual nerve. Now, the next question. The patient underwent a coronary bypass graft with great saphenous vein. The patient now complains of paresthesia and sensory loss over the medial aspect of the leg and foot. Which of the following nerves is most likely to be involved? The given clinical scenario in a patient with paresthesia and sensory loss over the medial aspect of leg and foot is suggestive of injury to the saphenous nerve. So the answer to this question is option B, that is saphenous nerve. Now the next question. During the clinical examination of nervous system, which of the following nerves can be tested by touching the highlighted structure? Let's see the highlighted structure first. The structure which is highlighted here is the uvula, and the sensory supply to the uvula is by the glossopharyngeal nerve. So, it is the nerve which is tested in this question, and so the answer to this question is option A, that is ninth cranial nerve or glossopharyngeal nerve.